Have y'all seen this? Y'all remember the movie about this? Welcome to She Knows DNA. My name is Miavana and I am a board certified genetic counselor. When it comes to the bubble boy disease, most of us pretty much know that that is a condition that attacks the immune system. But did you know that that is a genetic condition as well? Don't worry about it, I got you. Let's get into it. The real name for bubble boy disease is called severe combined immunodeficiency, otherwise known as SCID. SCID is a primary immunodeficiency type of disorder that is very life-threatening. What happened essentially is that there are not any white blood cells or T cells and B cells. The white blood cells are in our body to help us fight conditions, fight illness, fight bacteria. And since those cells are not fighting to protect our bodies, that is not a good scenario to be in. So imagine viruses and bacteria like E. coli, or getting the flu, getting COVID. If you have SCID, then things can be extremely life-threatening for someone that is affected. Without treatment, then someone with SCID can live to about 2 years old, if that. But if a child has any treatment, especially before any type of major infections get to their body, then that definitely helps the survival rate. There are multiple types of SCID. There's estimated to be around 20 different genes that whenever there is a pathogenic variant or a mutation, it can cause that particular type of SCID. But the one I'm going to talk about today accounts for about 30% of all persons with a SCID diagnosis, and that is going to be X-linked SCID. The gene that is not working appropriately is called IL2RG. This gene can be found on the X chromosome. When it comes to X-linked SCIDs, it's really a range or spectrum of symptoms. On one side, you have the typical type. On the other side, you have atypical. For those babies that have the typical form of SCID, you usually won't see any symptoms till around 3 to 6 months old. And that is because by that time, that's when the mom's antibodies that was technically helping the baby fight have now decreased and almost literally gone, to where that baby's own defense system has to work. But we all know with this condition, it does not work. Some of the features that you may see with someone with the typical SCID presentation include failure to thrive, oral or diaper rashes, recurrent infections, persistent infections, things like pneumonia, diarrhea, cough and congestion, fevers, sepsis, and many more. Those on the atypical side of the spectrum, their symptoms may not be as life-threatening as those that are typical. For these persons, they'll have that recurrent upper and lower respiratory tract infections. There can also be things like an enlarged spleen, enlarged liver, warts, and even have some type of abnormal skin features. Now, the reason why it's called X-linked SCID is because it's literally telling you how this condition is inherited. So whenever we are talking about X-linked, we are talking about the sex chromosomes. Females have 2 X's, males have 1 X, 1 Y. When you look at the demographics of who is going to be affected with X-linked SCID, is going to be the boys. Why? Because they just have 1 X chromosome. So if that gene is not working correctly on the X chromosome, then they have nothing to help them or back it up, so they're just going to get it. Versus a female, they could be considered a carrier of it if one of their copies of that gene does not work. They have that other one to back it up. The white blood cells are made by our bone marrow. Lots of the treatments that can not only truly help these patients, but even cure them, is they have some type of bone marrow transplant or some type of stem cell transplant or gene therapies in order to correct either that gene to cause it to work again, or to literally input or transplant those healthy stem cells or those healthy bone marrow cells in order for that to spread throughout the body to where they can then begin to attack any type of illnesses and diseases that their body was not able to attack before. There's something called the newborn screening, which is done by every state in the United States. Whenever your baby's born, you may expect them to do a prick on the baby's heel, then blood spots on a paper. And that screening tests for a a number of genetic conditions. All 50 states have SCID on their newborn screening. But that is really nice just to know that all babies that are born in the United States will be screened for not only this condition, but others too. And now to leave you with words of wisdom. Y'all, it's a lot going on today in the world, especially here in the United States. I mean, like, if you think about it, tragedies are commonplace. And there's so many sicknesses and diseases to where people are slipping away. Like, y'all, the economy is down and like people are not getting enough pay. Literally, we're in a government shutdown. People are furloughed, people are hungry, people are literally on the verge of probably even losing their houses because they have no food, no clothes. You know, it's pretty sad. Like, bro, folks are without homes. They're living on the street. And then some of them have drug habits that they can't beat. And then on top of that, there's always going to be those muggers and robbers to the point that there's no place that seems to be safe. So y'all, we really could be, you know, outdoors with no food and no clothes. And like just another number with a trash can. Really, it's not a laughing matter. As a matter of fact, it's a serious matter. The wisdom I have for you all is continue to pray for one another. Continue to check on one another. Unfortunately, even what they even talked about at church this past Sunday is that it's going to get worse before it gets better. So if you guys keep your head up, continue to pray. God's got you. We all have each other's back. It's going to be okay. Well, that's all I have for you today. Thank you so much for continuing to support She Knows DNA. Feel free to like, comment, subscribe, all the things. If you have a topic you want me to share, then go ahead and bring them my way. Don't worry, baby dog, get deuce. He sleep. Oh, the baby is, here he is. Don't worry, you already know I got my baby dog, get deuce, shape, right, play. He is with me, okay? You guys have an amazing rest of your week. I love you. God bless you. And I'll see you next time. Bye.